Okay, welcome to Insomnia Month. I am chatting with Dr. Tanya McEachern. Tanya, tell me about you and about what you do.
So I am a naturopathic doctor in Ontario, Canada, and I would say about half of my practice is made up of women in midlife. So I treat a lot of perimenopause, and of course, along with that comes, a lot of sleep issues.
Yeah, I know for me, it was the first time in my life that I had sleep issues,
Yeah.
and that was scary.
It's rough because it has so many implications. Like when you don't sleep well, it's this big snowball
Yeah,
effect into the rest of your waking life.
yeah, because most of the other symptoms that when we talk about them, so the stereotypical hot flushes or whatever, yes, it impacts people, but sleep just across the board, it means that you have no energy to do anything. It means you aren't drawn to eating healthy foods. You don't want to exercise. Everything just caves in, doesn't it?
You've got it, exactly. And, it's so funny because, if somebody comes in and they have low energy, the first thing you want to ask them about is their sleep. And sometimes we'll work on sleep and sleep will improve, but energy stays the same. So it's a funny one. Like it's a big part of your daily energy, but it's not the only part for sure.
No, no,
Yeah,
absolutely. And but I think interestingly, like the insomnia side of things, I mean, the energy thing is another whole topic that we'll dig into another time,
I
but
know. Yeah.
because I could talk for weeks about that. But the insomnia thing is interesting. I find that there's sort of the not being able to get to sleep, and then alternatively the waking up and not getting back to sleep. And I guess that's two different issues.
Absolutely, and especially in Chinese medicine, they reflect different imbalance patterns. The falling asleep and the staying asleep. Yeah, and of course, some people have both
Yeah.
both issues. Yeah.
So what sort of things are we looking at? Let's start with not fall, with problems falling asleep. What are we looking at
Yeah.
there?
Yeah. You always want to make sure that you have good sleep hygiene. So I don't know if anybody else has been speaking about that or writing about that this month, but it's basically, if you don't know what it is, it's kind of like best sleep practices. So it's like sleep behaviors. So it's going to be things like keeping your room, the room that you sleep in below a certain temperature because as you fall asleep, your body naturally has to go down a few degrees or else it's more difficult for sleep to begin. Other things too, like, the obvious stuff, like keeping your room really dark. We know that people that have screens in their room don't do as well. And then there's a few other things that you might not know, like avoiding artificial sweeteners,
Right,
especially in the evening, because it messes with the pineal gland. And that's where your melatonin secretes from in the
right.
brain. Also, avoiding fluoride is actually good sleep hygiene, which I mean is in a lot of people's toothpaste,
Yeah.
right? Is one of the things you do before bed, but that will interfere with the melatonin secretion as well. So just, some of those sleep hygiene practices are really, really good to make sure you're doing those things first before you reach for anything. They've done studies where even prescription sleep aids are equally as efficacious as good sleep hygiene.
Wow. And good sleep hygiene really, if we if we just do it, which a lot of us don't, I do know, there's no judgment there. It's too easy just to keep scrolling on the screens and stuff. But actually, it's remarkably simple to do.
It is. And it's like you don't even need anything external from yourself. It's talking about what do you do first, right? Like this is what you do first. The low-hanging fruit. Get the sleep hygiene stuff in order before we move, to the next step, right?
Yeah. So once somebody's got all that in order, what would be the next step? I mean, are we jumping straight to medical intervention, or is there something? Is there a sort of a halfway house?
I always say like there's a time and a place for every pharmaceutical and for every surgery. Like there is definitely a time and a place for these things. We're so glad that we have them. But they should ideally be the last resort. So it's like you've tried many things first, and then if you're still not having success, maybe that's what you go for. And those pharmaceuticals they're really only designed for short-term use. It's really only supposed to be to like re-trigger your sleep rhythm. So once you get beyond the 3 weeks of use, then you start to get into, well, like it's not really now managing the sleep issue like the way that it's intended to be used. And unfortunately, there are people that use sleeping pills for years at a time. And, it's kind of unclear about how are you permanently going to be changing your physiology. So we leave that as the last resort because it has the highest risks.
Of course. And
Yeah.
yeah, and they can be nasty if you're stuck on them for a while.
Yeah.
Yeah. So
First resorts. Yeah. Oh, sorry.
sorry,
Go on.
carry on. No, you carry on.
Yeah. Okay. So first resorts. A lot of people reach for melatonin first. And that's a fairly safe thing for most people to experiment with on their own. However, it doesn't work for a large percentage of the population. They'll try melatonin and they'll say, it doesn't work for me. And what I find is that melatonin is only helpful if you are deficient in melatonin,
Right.
which does get tested when we do urinary hormone testing. Melatonin is included. So you get to see someone's melatonin metabolites. And then in that case, sometimes then, okay, yes, melatonin might be the thing that's going to help you in terms of your sleep. So I
Mhm.
find that a lot of people start there, but it's not helpful for many. The one that I usually suggest we go to first is magnesium. And magnesium is a whole complicated topic in and of itself because you've got different forms and what dose, and a lot of people are scared of having loose stools and all that, but it really, really is the best place to often start for sleep supplement wise because most people are walking around magnesium deficient anyway.
Yeah. And you've got a free download, haven't you, that people can access on your website
Yes,
about
so
magnesium, so they can sort of
yeah, we'll
dig through
link
that
to
and
it.
find the right information. Because I know we could dig into it now, but I think it's going to be overload of information. Whereas if people want to download that, that's probably easier, isn't it?
Oh yeah, for sure. Where you talk about like what problem are you trying to solve? And then this is the form of magnesium in the research that you would want to reach for. And it gives approximate dosages and stuff too. So is it oxide? Is it bisglycinate? Is it citrate? Which one are you looking for? And so it makes it pretty easy to understand the way I've organized it.
Awesome. So then moving on to waking up in the night and not being able to get back to sleep. What are we looking at there?
Yeah, that one is trickier. You kind of want to get to the root cause of what that is. Why is that happening? If we're talking about our physiology, outside of the obvious stuff like my partner snores or my dog is waking me up, what are the
Yeah,
things that physiologically, what are we looking at? One of the things that is really, really common that I find on testing is you'll have cortisol spiking in the night. And that wakes a person up, especially if you're waking with a hot flash or with panic, because some people wake up in the night and it's like you're in an instant panic attack. And clearly you've been asleep. So it's something subconscious. It's not like you're awake and thinking,
yeah,
thinking, thinking, and then you create a panic attack, right? It's very coming from the unconscious, subconscious area. So sometimes we look at cortisol. Ironically, in a lot of men too, it's the same, the waking in the night, because it can
yeah.
be for both men or women. the cortisol is spiking, and it shouldn't be spiking until well into the morning.
No, it should be low overnight, shouldn't it, to let us
Very low.
sleep and then
Yep.
have its highest peak in the morning. Is that right?
Exactly. Yeah, you start when you wake up, you want it to start rising, and then the peak of the whole day should be like noonish, let's say, if you're
Yeah,
on a regular sleep-wake cycle. Yeah.
yeah. And am I right in thinking that if we look to Chinese medicine, those waking patterns overnight can point to different um, organs in the body?
You got it. So, the liver is a really, really important organ in Chinese medicine, especially when it comes to perimenopause. When you go through perimenopause, the whole typical like hot flash, insomnia, that kind of a thing is called liver and kidney yin deficiency. So you lose a bit of your yin as you lose some of your estrogen,
Mhm.
because estrogen is a very yin hormone. So think yin, think like cooling, calming, nighttime is yin, winter is yin, solid, while as yang is everything opposite, right? Heat, movement, energy, daytime, summer. Yeah. So you lose a bit of your yin. 1 to 3 a.m. is liver time. But sometimes with the Chinese clock, you'll get a problem. You can have a problem right after the
Gotcha.
window as well, but it could still be liver. But the
So
one that's
anything
3 to 5
waking
a.m.
between sort of 1 o'clock and let's say 3:30 then would potentially be liver. Yeah.
Yeah. Yeah. Yep. And you could
And I
also have problems throughout the day at that
and I guess
time.
our livers are working really hard because that's what's metabolizing our hormones, it's what's metabolizing our food, it's what I mean, they're just working.
It's a massive organ. And it gets almost no attention in Western medicine at all. Everybody cares about the heart and the brain, right? And the liver gets ignored, but liver health is tantamount to
So
overall health.
in very, very simple terms, let's not dig right into it, but are there any
Okay.
simple things we can do to support the liver so that we maybe get out of this cycle of waking overnight?
Yeah, gosh. Well, any any way that you can lead a low tox lifestyle is going to help, because even the people who are, the health fanatics, right? Like insanely healthy people with their health practices doing their absolute best, you still get junk on your food. You still breathe
Yeah.
air pollution. Like it's impossible to avoid toxins completely. So, but the but you can probably do better. So, like in any way that you can, start to avoid toxins and decrease your toxic burden. That right there helps the liver function a lot better.
Yeah. Yeah. And I mean, certainly here in the UK, I assume that this is available everywhere. There's an app called Think Dirty, and that tells you about what levels your cleaning products have of toxins, your
Yes.
skincare, and all of those things. And actually, oh my God, it's terrifying.
Yeah, I know. I know. I know. And this might surprise you, but one of the things that I try to do with all of my patients for their liver is get them on reverse osmosis water.
Okay.
That is a huge toxic source for people. And, I live in Canada, right? So I'm thinking about, typically Ontario water. But it's going to be similar in other industrialized nations. And the worst thing that comes in is pesticide. That is the worst thing, that if you're drinking regular tap water, really anything except for distilled and reverse osmosis, anything else lets pesticide through. And that's one of the worst things to get into the liver and chunk up all those enzymes that we need firing at, hundreds of thousands of reactions per second.
Oh, that's terrifying. I hadn't even ever thought about all of that being in the water course.
Yeah.
Brilliant.
people's medications,
Yeah,
birth
everything.
control. Birth control doesn't get filtered out very well at all. Medications for high blood pressure, like you're drinking, all of that.
Really
And it's
scary.
allowed.
Yeah, I know. Yeah.
It's allowed because it's trace, but the liver picks it up.
Yeah. So liver kindness, so avoiding toxins where we can, obviously.
Yeah. Yeah.
What about things like milk thistle? Are you a fan or not?
Yep. Yep.
Yeah.
Typically. Yep. Um, the liver, it's like sometimes it's not ready for that right away. But typically at some point, the person tends to benefit from milk thistle for sure. Yeah. But it was not usually where I start.
Cool.
Sometimes people, you got to go in, you got to clean things up first before you
Yeah.
go to that one. But yes, yeah, there's definitely herbs that can be helpful.
Awesome. So if I summarize, to get off to sleep, we want to focus on sleep hygiene and
Magnesium.
potentially melatonin, but
Yep.
likely not, and have a look at magnesium. And then for staying asleep, we want to be looking at cortisol, so stress generally, and liver health.
Yeah, those two things. And certainly magnesium can help with the staying. It can help with the staying as well. Yeah.
Amazing. I feel like we've covered loads and I'm not going to overwhelm people with too much more information. So thank you so much, Tanya.
My pleasure.